Hello. So we just wanted to create a lesson about lab, so sort of instructions on lab and some expectations, just so now that you've completed the online portion is you're getting ready to enter the laboratory portion of the class, you just sort of have an idea of what to expect so you can help prepare further for this next portion. So, what to expect? So, what we're going to do within this is we're going to give you sort of an introduction to the lab area, what it looks like, what will be there, and things like that. We have some pictures later on in this slide. And what's going to happen in lab is basically that state skills exam guide that's under course materials on the main page of the CNA course has several different skills in there, 21 to be exact. And what's going to happen is our instructor is going to demonstrate those 21 skills for you. And then after they demonstrate the skills, you're going to be expected to practice the skills. So typically how it works is once you come in, we're going to introduce you, make you feel comfortable, just go over a few quick things, and then we're going to have you, and we're going to pass out that skills packet for you, so you don't need to bring it with you. We'll have a copy for you there. We'll have you read the first skill. The instructor will demonstrate it for you so you know exactly what you're supposed to be doing. You get a good visual of what that looks like. And then you will practice yourself with your partner or with the mannequin, depending on which skill it is. And the instructor will be there to help watch, to give you tips, tricks, any recommendations as you're practicing. The whole goal of this hands-on portion is to get you comfortable and confident with these skills in a classroom setting with your classmates, with the mannequins, with the instructor. So that way when you get to the clinical portion, you're ready to safely take care of these patients. So this lab portion is extremely important for you to be able to demonstrate that you can safely go into clinical. It's important that you're focused while you're in lab, that you're paying attention to the instructor, that you ask questions as much as possible so you have as much information that you need to get ready for clinical. Some of the things that you are going to be learning are, like I said, all those things in the packet, things as vital signs, ambulation, range of motion, how to give a bed bath, how to make a bed, perineal care, how to change a brief, hand and nail care, bed pad, feeding, all those types of things you're going to be learning. So it's going to be a lot of skills in a short period of time, but we want you to practice as much as possible. If you feel like you need more time, make sure you communicate that to us. The instructor will also communicate with you anything that they feel that you may need to practice on more as well. But, everybody does really well in lab as long as they come prepared and they come ready to learn and practice. All right, so before we get to the actual lab area, what it's going to look like, some equipment you're going to be working with and that, we wanted to go over some important documents. If you remember in the very beginning of the online classroom, we talked about a purple folder. We've sort of moved the purple folder to an online format. That way, if you guys lose anything, you can come back here and download it. So below this video in the lab section or lab lesson, you're going to find all these documents I'm about to go over for you to print off if you want to. But I'm going to go over each form in detail. That way you have a good understanding of the form, what it's used for, and all of that. So the first form I'm going to go over is everybody's favorite form. So this is what we call a reimbursement form. What's really cool in the state of Michigan is that after you complete your training, if you go work in a long-term care center, which is any nursing home in the state of Michigan. So it can't be in assisted living, a hospital, a rehab. It has to be a nursing home, a long-term care facility as a nursing home in the state of Michigan. You can get reimbursed up to $951 of your tuition right now. Now that typically goes up every year. So in 2021, it may be more. But right now, that's the number. So since our tuition, so right now you can get all your tuition back if you go work at a nursing home after you complete the course. So everybody loves that, right? You can get the money back from your class. Your class was essentially free. So what you'll see on the right-hand side of this slide, there is a form that you have to fill out and give to your HR department in order to get this. The top portion, you just fill out your information, ask for your first, last name, social security number, birth date, things of that nature. Then it asks where you took your training program. That's going to be us. So put all our information in there. You'll need to print off your invoice and send and give it to your HR department wherever you go work when you fill out this form as well. You can print off your invoice by going into the student portal, click on My Payments, and then if you click the invoice number, it will pop up your invoice where you can print it off so you can attach it to this. Where it says below where you put your training information, you're going to put the date you took the state exam, the clinical portion and the written portion. It's typically done on the same day, and where you took it and the cost of it. And then you'll finish down here by signing whether you've received money for it or not. Typically people haven't, because if you're just filling this out for the first time, you shouldn't have gotten any money for it. And then once again, you'll give this to your HR department. Now, they technically have 1 year to give you this money. Some places give you a check right away. Some will give it to you after your 90 days. Some break it up over the year in increments. It just depends on the facility how they want to do it. But by law, within the first year, within 1 year of you turning in this form to them, they have to give it to you. So make sure you take advantage of this if you go work at a nursing home after the class. This next form is going to be the Nurse Aid Clinical Skills Test General Instructions. So these are just basically general instructions for you at the state exam for the clinical portion. Now, I highly recommend you download this and read through it. The more you know, the more that you're aware of and expecting when it comes to the state exam, the more comfortable you're going to be. The sort of the unknown is what's nerve-wracking, causes anxiety. And with the state exam, you want to be as calm as possible. You want to be as confident and as comfortable as possible. So I highly recommend just going through and reading these instructions just so you have a better idea of what's expected on you when you go to the exam. So we try to give you as much information as we can for it just to help prepare you as much as possible. We want you guys to be successful on your first try, and we want to make you feel as comfortable and confident as possible. If you have any questions as well, just like anything else, don't hesitate to reach out to us on this either. This is going to be the timing sheet for the clinical state exam. So for the clinical portion, it is timed. This breaks down approximately how much time you have for each skill. It explains how they put together your total time. It gives really good instructions on the timing portion. We will not be timing you in the lab portion. When you come into the lab for our class, our goal is for you to take that time to learn, to make mistakes, to be able to correct them, for us to help you to build your confidence. I don't want you worried about time in lab. So don't worry about this in lab, but when you go take the state exam, they will be timing you. So just make sure you're aware of it. I find that most students finish with plenty of time left on the clock for the clinical state exam. However, if you don't study, if you don't prepare, if you don't know what you're doing when you go in there, you're going to run out of time. So just make sure you're aware of it. But I tell students, don't overly focus on it. I don't want you to become more nervous, more anxious, worrying about the time more than you worry about completing the skill correctly. But I like to throw this out there. So once again, I suggest downloading it and reading through it. Any questions you have on it, shoot us an email, give us a call, and we'll help you with better understanding if you need it. This right here is exactly how you should apply for the state exam. You are not eligible to apply for the state exam until after you receive your certificate. So after you complete your clinical portion of the class and get your certificate, then you can apply for the state exam. We do not send your information over until after you've completed our class successfully. So Prometric will not allow you to sign up. They will mark your application as incomplete if you try to apply before you successfully finish the class. But once you do, you are all set to apply. As soon as you get your certificate, we'll send your information over. So definitely do this. I always recommend applying for the state exam sooner rather than later. It always takes a few weeks during the good time to be able to get in and get a test date. So the sooner the better. And with everything going on, depending what time of year you're taking the class, with the location, things like that, it can be several weeks, it can be months. So the sooner the better. People tend to do better when they take the state exam as soon as possible. So after you follow those directions and apply for the state exam, you're going to receive a few different emails. So I just like to give you an idea of what to expect. So I always suggest doing the application online. You have the option to print out a paper application for the state exam and then mail it in. However, it takes much longer for them to process your application, mark you as complete, and get you in line to take the state exam. So the directions we have over on the previous slide were how to do it online, which I highly recommend. So after you fill that out and submit the application, this picture on the left is the email you'll get once they finish processing your application. Sometimes they process it the same day. Sometimes, it takes several days. So it varies on when you should expect this email, but make sure you're looking in your email for this document right here. What it will say is the date that your application was received, the date that it was completed, and whether it's complete or incomplete. All right, if it's incomplete, you're going to have to call them. You can find their number on the Prometric website where you apply for the state exam, which is on the sheet on the previous email. If it says complete, right below that it says test date. Now, typically 99.9% of the time this is blank because they don't have an open test date right away. So that's normal. What's going to happen then is you are going to wait for this second email. And what the second email is going to be is what's on the right side of the screen here, which is your actual test letter. So this is what you also have to bring with you when you test. So once again, what's on the right-hand side of the screen. It will have the date and time of your test, and it will have the location. Now, what you'll typically see is it will say written, date, and then the time, and then it will say clinical skills, the date and time. Now, your written and clinical should be done on the same day. And what you'll notice is the time for written will be like 9 a.m. or whatever it says on there. And then the clinical will be scheduled 5 minutes later. Now, that doesn't mean you get 5 minutes to take the state exam. But what it means is that you're expected to stay once you finish the written. Your clinical portion will be directly after. So don't worry about the time on there. A lot of students always call us concerned about that. That's normal. That's just how they put it on there. So you know you have to stay and do both portions back to back. So that's what that looks like. Now, a little loophole that I like to tell students about is when you get this first email saying that your application is complete, if you don't have a test date, which most of the time you're not going to, like I stated, if you call Prometric, once again, the number's on the website where you apply, call them and let them know that you're willing to drive to other locations. And then what I would do is on the Prometric website where you apply for the state exam, there is under candidate resources, there's a test center list. Pull up that test center list when you call them. Let them know what locations you'd be willing to drive to. And most times what they'll do is they'll pull up those locations and they can get you scheduled sooner than if you didn't call them and just sat and waited. I've had students get scheduled the following week by just calling, where other students waited 3 months to get a test date during our busiest or the busiest time of year. So that's just a little loophole I definitely suggest doing if you want to test right away. The good news is in the state of Michigan, you can start working while you're waiting to take the state exam. So once you've successfully passed our class, you have the certificate from us in your hand, you can start applying for jobs and start working while you're waiting to take the state exam. That way, if you have a little bit longer of a wait, you're not out of a job while you're waiting to do that. Now, if you do have a little bit longer of a wait, like I said, don't just sit back and not look at the skills guide, watch the videos or anything like that. Go back through. You have access to the online portion of this class for 4 months. So you can go through, rewatch videos, lessons, go through that state exam skills guide. Make sure you're fully prepared for the state exam. It's not something you want to have to do twice. So take that time to study. Right here is the state exam skills guide. You'll find it in this lesson as well in the course materials on the main page. This is what you'll be going over in lab. It gives you an introduction to what the state exam consists of, both the written and clinical portion. It also gives you a step-by-step detailed guide on how to complete each skill, exactly how the state is looking for it to be completed. All right. If you follow this guide exactly how we have it set up, you will pass the state exam. If you deviate from this, I cannot guarantee that you will pass the state exam. So I definitely suggest going over this. This is what we'll be using in the lab portion of the class. This is what's being used in the videos that we demonstrate these skills as well. So just take your time to look over this. We'll cover it in detail, like I said, in the lab portion. So this Prometric clinical skills test checklist sort of goes hand in hand with the previous checklist, which is the heart-to-heart state exam skills guide. So what this is this is what your actual nurse evaluator, the person watching you take the state exam, is going to have in their hand checking it off. The thing with this one is it's not detailed. It doesn't necessarily say when you're supposed to do what. It's more of in question format for the evaluator to use. But it's good for you to pair it with our guide so you understand why we're asking you to do what you're doing, because this is what they're going to be looking for. So that's why we pair these two together. I like you to sort of have this so you know exactly what they're looking for and why you're doing what you're doing in regards to the heart-to-heart state exam skills guide. Now, indirect care is on the state exam. There was a whole lesson on indirect care that you should be aware of. And the biggest thing that I like to tell everybody about is they've been super strict on indirect care. So make sure you read through this indirect care guide. Make sure you're really focusing on indirect care when you're going through these skills. So, make sure you download this, go through it, read it. Make sure you understand exactly what they're looking for and that you're getting all those check marks that they're looking for. This is some medical abbreviations. It's going to be really important for you to know, look at, and understand, as you're going to see a lot of these in the clinical portion. You may see some of these even on the state exam. So make sure you download this, go through it, and study these as well. These are measurement forms. These are going to be used on the state exam. So at the state exam, there's not going to be electronic charting. It's going to be these four sheets. There's only 4 skills that require you to record. If you do not record on the 4 skills that require these forms, you will fail. So I just like to show you what they look like so you know what you're looking for. So this first one here is the respirations form. The next one is pulse. As you can see, they look almost identical. The only difference is in that gray highlighted area. The one says record respirations, the other says record pulse. So make sure when you're doing pulse or respirations, if you get one of those skills at the state exam, that you collect the form as part of your equipment so you have it there as a visual reminder that you need to fill it out as part of the skill. The next one is intake and output form. This one is for emptying the urinary drainage bag, just so you see what it looks like. Lastly is the food and fluid intake form. This is for feeding at the state exam if you get that skill. All right, now that we've gone through all those forms for you to understand and know, I want to get into the lab rules, all right? 1, we are super excited to have you in lab. This is one of my favorite portions of the class because you finally get to be hands-on. You get to take all that information that you just learned in this online portion, and we get to actually start practicing the hands-on. All right? So 1, make sure you're on time. We start right at the start time. All right? We don't wait for people. We get in and we get started. If you miss any time, you are not going to be able to start because as soon as we get started, you need all of that information in order to continue. So if you're late, you will not be permitted in that lab and you will have to make it up if that's even an option. All right? So make sure you're on time. If you're not on time, if there's an emergency or anything, I cannot highlight this enough. You have to communicate with us. We can't read your mind. We don't know what's going on. If you don't communicate, we can't help you. Just like anything else in life, if you're late to a job, if something's going on, you have to communicate to your instructors, your professors, your supervisors, your boss, to let them know what's going on, all right? People are much more willing to work with you when you communicate and explain. There are no absences allowed. So once again, you have to be there the days you sign up for. You must be present for. You must communicate if something's going on, and we can let you know if it's something we can excuse or not, but make sure you communicate. Make sure your phones are not out during lab, all right? So when the instructor is teaching, when you and your partner are practicing, your phone should be tucked away. The only time your phone should ever be out is before class starts, after class, or during breaks, all right? We don't have a ton of time for you to learn all this information, so we need you to take full advantage while you're in class. If you're on your phone, you're not focused, you're not practicing properly, we can allow you to successfully move on to the next portion, which is the clinical portion where you're going to be taking care of people's loved ones. So you have to take this lab portion very seriously to prove to us that you can safely go to the next step of taking care of actual patients, people's loved ones. During the COVID-19 pandemic, masks must always be worn in the classroom. They cannot be taken off, so you have to have a mask. You are responsible for providing your own mask, so you must have it on when you enter the school. And this will continue for as long as we have to during this COVID-19 pandemic. So just make sure you have one with you when you enter lab. Like I mentioned before, your full participation is going to be required, in order to successfully pass lab. I just can't tell you how seriously we take this. Our standard for you is that as you are finishing up your last lab day, what we're looking at is if my mom or my dad were in this nursing home, would I allow you to take care of them? That's the standard. Would I allow you to take care of my own family member? If I can't say yes to that, how can I allow you to take care of other people's family members? So we're just looking for you to take it seriously, to put in effort. If you need more practice, if you're struggling with some skills, that's not a problem. We're not going to fail you. We're going to work with you. We want you to succeed. But if you're not putting in effort, if you're not participating, that's a different story. So make sure you're taking it seriously. Before you show up to lab, make sure you review the state exam skills guide and the videos. That way you're fully prepared and really ready to soak all that information in. You already have a little bit of a foundation of what you're going to be learning, and that instructor in there demonstrating will help build off that foundation. Before you enter lab, as a reminder, your entire online work, except for the state exam lesson, must be completed with a 75% average or higher in order to be able to enter lab. So we'll be checking before every lab that you have that completed and that your average is 75% or higher, okay? If you're having trouble completing the online portion, if you don't have a 75% average or higher, communicate to us, email or call, and we will see what we can do to help you, all right? Lastly, in lab, we expect you to clean up after yourself. We cannot constantly clean up after every single student. So what this means is all the trash should go in the trash can. Any dirty linen should be in the hamper, and any supplies you take off the shelves should go exactly where we had them before. When you leave your station at the end of lab, everything should be neat and in order and well taken care of. The bed should be made. Everything should look the way it is when you entered lab. Here's a quick breakdown of what each lab day will look like. So we have lab day 1, lab day 2, and lab day 3. You'll notice lab day 1 has a lot more skills than lab day 2 and 3. Reason being, it's your first day. This is sort of giving you a good foundation before we get to the other 2 days. But these skills are also a little bit shorter and easier as we move through the different days. They sort of become a little progressively harder. So lab day 1, and just a quick rule that I forgot to mention in the previous slide, is whenever you come into the school from the outside, whether it's for lunch, a small break, you're just getting there for the day, you are going to immediately, after your screen for your temperature, you're going to make sure you have to answer a few questions about symptoms, and then you're going to go to a sink, wash your hands with soap and water. We are going to go over how to wash the hands on the first day as well, but there's also the video, so you should have a general idea on how to do that. So you need to go wash your hands every time you enter the room or the school from the outside. So hand washing, you're going to learn about indirect care, entry and exit protocol, pulse, all your vital signs. So pulse, respirations, blood pressure, temperature, oxygen saturation. You're going to learn about the 3 different range of motions: shoulder, the elbow and wrist, and the hip, knee, and ankle. You're going to learn how to move patients in bed when they cannot move themselves. You're going to learn how to change somebody to a side lying position. You're going to learn hand and nail care and foot care. All of these skills on lab day 1, you'll be practicing with each other. These are none of these are mannequin skills. So you'll be with a partner at a bed station, and you and your partner will be practicing all of these skills together. As of right now, or the latest because of COVID precautions, we are not having people interchange partners. You'll be with the same partner for the entire day. Lab day 2 is going to be mouth care, denture care, dressing, partial bed bath, occupied bed, and bedpan. So for any skills that require us to take off a mask, for example, mouth care and denture care, we will not be doing on another student at this time. Obviously, as things change, different COVID-19 precautions are released, we may change this, but as of right now, we will have you to be doing mouth care, denture care, and then feeding on lab day 3 on a mannequin, not on each other like we typically would do. All right. Lab day 3, peri care, catheter care, measure and record the urinary drainage bag, feeding, ambulation, pivot transfer, and then we'll also have you practice what we call a full bed bath and beyond, which is a combination of a lot of different skills. So that's the breakdown of those 3 days, what to expect, the skills you'll be covering. So make sure you're reviewing the skills that do have videos, going through your skills guide so that you're ready and to learn, to practice, and really get as much information as you can from these 3 days. So obviously there's going to be a lot of supplies and equipment that we're going to be working with in the lab. Some people who have experience, you might have seen some of these. Some of these are obvious. I just want to go through and introduce you to these supplies, talk briefly about each of them. That way, when you go into lab, you just have a general idea of what these are. It saves us a lot of time in lab where we can really focus on the skills, not the equipment. As always, if you do not know how to use a piece of equipment, make sure you just ask. There's in the healthcare field, there's a lot of different manufacturers, a lot of different kinds of the same type of equipment, but just used a tad bit different. So it's okay if you're not 100% sure. Just ask, especially when you're new. So these are examples of different type of hospital beds that you may see. The typical beds that we have in the room are the top right one. You'll see here on the left, there's some hospital beds that have all their controls on the side rail. There's some hospital beds that have a remote attached to it, some that have it on the footboard and have a remote. So you'll see we have all different kinds of beds in the school. That way, no matter what type of facility, what type of bed that you work with, you will be able to see sort of how it works. So just a quick brief overview of what that looks like. Here are examples of different hospital remotes, okay, or bed remotes. You'll see on this far left one, the top 2 buttons control the head of the bed. The middle ones control the foot of the bed, and the bottom control the height of the bed. You'll see this middle one. This is more of a hospital type remote. It's going to actually work with the TV, the volume, as well as a call light. And it may also sometimes change the settings on the bed as well. You'll see the one on the right here. The top one is the head of the bed. The middle is the height of the bed. And the bottom is the foot, indicated by those symbols. So it's always good to look at the remote because there's about 10 million other types of remotes out there. They all look very similar, just a little bit different. So always just sort of check, look at the symbols before you start moving the bed. So you don't jar your patient, move them in a way that you shouldn't, or things of that nature. This is what we call an overbed table. This is where you will be also putting a lot of your supplies when you're going to help a patient. However, this is where the patient keeps most of their personal belongings. Things like the TV remote, their phone, notes, books, reading material, drinks, snacks, anything you can imagine, glasses, hearing aids sometimes, dentures they'll throw on there. They have a lot of stuff on there. So this is something that is a part of our exit protocol. Whenever we leave, we want to make sure they have their belongings within reach. Typically, all of their belongings are on their overbed table. This table can slide right over the bed. It can adjust in height. You'll see there's a little lever here on the side closest to the right side of the screen. that you can pull up on and adjust to it so it's taller or shorter, depending on what the patient needs. So that's something we use a lot in the classroom. You'll use a lot in the real world as well. This is just going to be an example of the different sheets. So when I'm using or referencing them, you know what I'm talking about. The fitted sheet, also known as the bottom sheet, is labeled right here. It's the sheet that goes around the around the mattress. Excuse me. It has tight elastic corners on them, typically to help keep it fitted around the mattress. Your flat sheet is the top sheet that goes across the bed. You have the pillow and then the pillow case or pillow cover. This is typically how the bed should look when somebody's not in it. It should be nice made, nice and neat, everything tight and wrinkle free. This is how you're going to be expected to leave your bed at the end of every single lab day as well, so everything is neat and clean. This is an example of a bath blanket. A bath blanket is sort of in thickness between a sheet and a comforter. It typically is used for things like bed baths, dressing, undressing, making beds, peri-care. Anytime that a patient may be exposed, we use this for not only privacy, but also for comfort and warmth. A lot of our patients are cold in the nursing home setting, in the hospital setting, so this acts as not only a privacy cover for them when we're working with them, but it also helps keep them warm. Bed pad is the next thing we're going to talk about. We have two different types of bed pads here. The left one is a reusable bed pad. And the right one here, these are disposable bed pads. So one-time use, throw away when they're dirty or when we're done with them. Bed pads are going to be used when a patient is incontinent, say they leak out of their brief. What happens is the incontinence pad or bed pad here soaks up that liquid so it's not sitting or they're not laying on it. It sort of wicks away from the body here. We also can use this to help adjust patients in bed, moving them up, down, side to side as well. There's sometimes we use a draw sheet that acts sort of like a bed pad. It's a top sheet or a flat sheet, and it's folded into a rectangle and placed under the patient, just like you see in this picture of the bed pad, and that can be used to move patients as well. If you notice, the bed pad is horizontal on the bed, all right, and it goes about all the way up to the shoulder blades, maybe a little higher, and then down to the knees. It's important that it's in that area on the body. You want it about shoulder blade height on the back down to about mid-thigh. That way, when we go to use to help move the patient, it's in a good position. We hold most of our weight in our midsection, so that's why we want it under the mid area of the body. Also, if we're using it for incontinence, if a patient leaks through their brief, their underwear, they have an accident, whatever may happen, that's in the center part, their buttocks, that area of their body, their waist is in the center part of that bed pad. A lot of times we'll use these disposable pads, these blue pads that you see on the right, as barriers on our overbed table as well. So that's something you may see. This is a clothing protector. This is what we put on our patients when we're assisting them with meals and snacks to help keep their clothing clean, their sheets clean. Just a little quick note on these. These are what we call clothing protectors. We do not use the word bib out of dignity and respect for our patients, so always use the term clothing protector. If your patient wants to call it a bib, that is completely acceptable. They can use whatever words they want, but we should always communicate in a way that shows dignity and respect, and that is partly by calling this a clothing protector. We are going to use different basins. You'll see two basins here. On the left is an emesis basin. On the right is a wash basin. The emesis basin, if you see, has a curve, all right? That curve should go against the mouth. We typically use this for mouth care, denture care, things where the patient might need to spit. Our wash basin, we're going to use things for like bed bath, peri-care, hand and nail care, foot care, things where we need more water soaking is occurring. Just a quick note on basins. Basins are always soap-free zones. We're not going to put soap directly in the basins. And you'll get a better idea of that when you saw the indirect care, touch base on it in that lesson, but I'll also touch base in it in clinic a little bit. But biggest thing to know, just soap-free. Some of the hand and nail care type equipment you're going to be using is what we call an orange wood stick and a nail file. To the left is an orange wood stick. You'll notice one side has like a toothpick type side, and then the other side has a flat edge. We are going to use the flat edge to clean out from under the nails. This is what we use to clean dirt and debris out from under people's nails. So this is definitely what something we will be using in the class as well. On the right is a nail file. You'll also see that it shows how to properly use it. You should go in one direction, not in a sawing back and forth motion. All right, so just a little reminder when you use the nail file, how to use it properly. This is an example of different bedpans. We have a regular bedpan, bariatric bedpan, and a fractured bedpan. So the first one is on the left. If you notice, it sort of looks like a toilet seat. Their bottom goes on the area furthest right of that picture. The front, where the flat edge would be facing forward or towards the foot of the bed on the bed when the patient's laying under it. We use these for people that are continent because they have to be able to tell us they have to go, but they may be on bed rest or unable to get up and out of the bed. This middle one is a bariatric pan, just for larger patients. Same concept. Their bottom or buttocks is going to go actually on the left side here, and the front of this, so the right side of this picture in the middle, would be towards the foot of the bed if it was laying directly under the patient. Then you have your fractured bedpan. These are for patients that have maybe recent hip surgery. They have some type of issue going on where they can't lift their hips as high as someone else. If you notice, the left side of this fractured bedpan is a lot shallower than the other ones, and that is where their bottom goes. The handle always goes in front or towards the foot of the bed. Some of the denture supplies you're going to be using for mouth care is a denture brush, which you see here on the left. You'll notice it has two sides. It has a normal toothbrush looking side, and then it also has an elongated side. That elongated side that sort of sticks out and is smaller is used on the portion of the dentures that go against the gums, sort of the grooves. Those can be deep, and the normal toothbrush side can't always fit in there. And we want to make sure we're getting any food, debris, denture glue, or paste out of the dentures. So that's why you have both sides. On the right here, we have a toothette, or what we call a foam tip applicator as well. This is used for people who are what we call NPO, nothing by mouth. They may be unconscious. They might be in the death and dying process, or for those people that have dentures. So we'll use this on people that do have teeth as well, and that's, like I said, the NPO, the nothing by mouth, or the death or dying people that are unconscious, for comfort. If you've ever thought about it, if you've ever not been able to eat or drink, you just didn't have water, your mouth was really dry, that's an uncomfortable feeling. So what we'll do is we'll get this toothette wet, and we'll just sort of gently go in and sort of lightly moisten the inside of their mouth for comfort. Now, we do use this for denture care as well, because when the dentures are out of the mouth, we still have to clean the mouth. And the gums can be very sensitive and bleed easily. So when we go in with something that's a little bit more gentle, like this toothette or foam tip applicator, it allows us to clean the mouth, but also make sure we're being careful and gentle. Some other mouth care, denture care supplies are going to be a denture cup and dentures. So you'll see the cup is on the left, dentures on the right. Whenever dentures are not soaking or in the mouth, they should be soaking in a denture cup. We always use room temperature or cooler water, as warm temperature can deform or warp dentures. They're also usually held together by glue, so warm temperatures or hot temperatures can melt that. Same thing, if you don't soak dentures when they're out of the mouth, it can also warp and deform them. So it's really important you're always soaking them in the denture cup whenever they're not in the mouth. We're going to move into catheters now. This is an example of a catheter. I know I had some pictures in the lesson that covered catheters, but just to give you a little bit of a better visual, this is the tube you will see that will go into the meatus through the urethra into the bladder of a patient. Now, the balloon will not be blown up until it's entered into the patient's bladder. And then what they do is the end here that has the balloon blown up will be blown up. And that acts as a stopper, so it just can't slide right out of the bladder. So once again, it's not, the balloon at the end isn't blown up until it gets into the bladder. Then we blow it up to help keep it in place. The end down here is where it attaches to the urinary drainage bag, which is I'm going to show you next. So what you'll see here is we have two types of urinary drainage bags. The one on the left is just a normal urinary drainage bag, and the one on the right is a leg bag. You are allowed to switch out between the two. We see most often than not that patients during the nighttime want this urinary drainage bag, but during the day, for privacy reasons, when they're up about walking and moving throughout the facility, they'll put this leg bag on. And the leg bag goes on under the pants. You strap it around the leg so it's tight so it just doesn't slide down. And the end of the catheter that we were just looking at, not the one with the balloon, but the other end attaches to it. And then all the urine will drain into this bag, and then we can empty it as needed. So you'll be in charge of emptying and recording any contents of these bags, and that's a skill you'll be learning. Just wanted to show you the two different types, and that you as a CINA are typically allowed to change between the types. It's always important when somebody has a catheter that if to check any tubing for kinking, for any kinks, to make sure that the urine can always flow out and it doesn't back up in the bladder. Also, a reminder, these bags should never be held above the level of the bladder because they will drain by gravity, meaning that the urine in the bag will then go back into the bladder, which can cause infection and other complications. This is a graduated cylinder that we'll be using, or a graduated container that we'll be using in class to empty the urine out of the urinary drainage bag into so we can properly measure it. Here's an example of a gait belt. This is what we use to help patients stand, sit, transfer when they are not able to help themselves. As a reminder, this goes on the mid-waist over clothing. It should be between the ribs and the hips at about the belly button level. It needs to be tight and secure so you can just get your fingers underneath the gait belt. We don't want the gait belt sliding up and down their body because the whole point of it is to use it to have something secure to grab onto that when we go to help stand them up and sit them down. We also just want to be cautious though that you're not putting it on too tight to hurt the patient. These are different examples of shower stretchers and chairs. We will not be using these in labs, but in clinical, this is definitely something you will be doing. So just wanted to show you different options. It's going to depend on the patient and the patient's ability on what type of shower chair you may need to use. If a patient's able to sit up themselves, they're quite independent, you'll use one of these two bottom left ones. If a patient can't sit up, it's difficult for them to sit up on their own without falling over. This stretcher on the top left would be the proper one to use. Patients, the one in the middle might also be. Patients who can still sit up on their own but need a little bit more support would use the one on the right. So it's just all about learning about your patient, what they can and can't do, and choosing what's safest for them. These are a ton of examples of wheelchairs. The first wheelchair does look different than the rest. You'll notice the wheels are smaller. So the furthest left wheelchair is what we call a transport wheelchair. That's when we're moving somebody within a facility from room to room, say their bedroom to the bathroom, bathroom to the shower room, whatever it may be. You notice the wheels aren't big and large, where the other three wheelchairs, they're all a tad bit different, but their wheels are larger and more stable, so they can go outside on sidewalks, on the road, different things like that, where this transport wheelchair cannot. It's not stable enough for that. You'll notice this one's the second wheelchair reclines back. It has a longer back, more support, can also support the head. The leg rests have more support as well. The second one is a standard wheelchair. You'll see it has extra support for the calves and lower legs, where the furthest right does not. It's important to always understand every wheelchair is a little bit different. You need to make sure all the wheels are locked, or you know how to lock them. So when you're transferring patients to and from, you can make sure you're doing it safely. You need to also learn how to remove or move the footrest off to the side. Every wheelchair can be a tad bit different, but they all work basically the same. You'll see in lab how you can move them. We'll go over that with you. Lastly, these are examples of wipes. Most times when we're doing perineal care, catheter care in the real world, we're going to use wipes to help clean our patients up. You may also use wipes to help clean hands. You can also use washcloth to wash, rinse, and then a towel to dry. But you'll see that we'll use wipes. We'll talk about that a little bit more in lab as well. So just a little example of what the lab is going to look like. So we have beds set up for you guys. Next to each bed, you're going to have a little storage shelf unit. It's going to have all your supplies on there, from your basins to your gloves to your washcloths and towels, bedding, clothing protectors, anything that you may need, wipes, basins, like I said, graduated cylinders. All of that is going to be right there for you. You'll also have a trash can next to your bed and a hamper. That way you do not need to move far from your bed to get anything that you need unless it's water. You'll obviously have to go to the sink to get that. So just wanted to give you a little visual of what to expect when you come to lab, what it looks like. There'll be 2 people set up at each bed typically. Depending on the skills that we're doing, we may be able to have just 1 person at each bed. But once again, that's going to depend on the number of students in the class, what skills we're on, and such. So this is just a general idea of what to expect and what it will look like. All right, guys, so that sort of covers everything for the lab lesson. Goes over your equipment, your expectations, instructions, all that fun information. If you have any questions at all, please make sure you shoot me an email at k4@h2health.com. Once again, we are super excited to have you guys in lab. We're excited to have you continue your learning to get that hands-on experience and get you guys moving closer to successfully finishing this class. So we will see you shortly in lab.